Hi, Dr. Affan. Welcome to ZoomMD Doctor's Corner. Today, we have joined by Dr. Affan Akhtar, a board certified by the American Board of Foot and Ankle Surgeons, who also specialize in wound care and sport medicine. Welcome, Dr. Affan.
Oh, thank you for having me, Gul.
Dr. Irfan, this is a ZoomMD Corner podcast where we, highlight different doctors who are working with us, and we are doing, web services, digital marketing, and SEO for them to increase their patient intake and flow. So, with that, I'm just going to start and jump on the questions. The first question I have is, so Dr. Irfan, how would you describe yourself as a physician?
Um, I'm empathetic. Being a keen listener is key to understanding my patients' goals and expected outcomes.
Great, great, awesome. I think this is very important for a doctor and a patient to feel comfortable with the doctor. The second question we have for you is, what makes your approach to foot and ankle care different from others?
Um, so foot and ankle care is actually very personal to me. I've had growing up as a child in the UK, I played a lot of sports. For
Mhm.
me, playing sports is something I did daily, 7 days a week. Soccer, sometimes 4 days a week. Cricket, field hockey,
Mhm.
basketball, you name it. I played
Mhm.
track and field. We used
Mhm.
to call it athletics, but that was something very, very big for me. So I needed to get into a field that I could relate to, and my patients can likewise do the same. Not to mention my training, my medical training was quite vast. At the behest of my fiance at the time,
Mhm.
who wanted me to stay local during my residency, I decided no, I needed to prioritize on my field, and so I got accepted in New England. I did training in Boston Medical, Brown University, and Rhode Island Hospital, which is a trauma level one center, where I felt I got the best possible training I could you could possibly get, in my opinion, in the Northeast.
Mhm. Okay, that's nice. Great, great answer. Okay, great. Now we have a next question for you. Can you share a patient story that reflects the kind of results people can expect from you?
Yeah, a very specific patient I remember, top of my head, is a lady that was in her 60s at the time.
Hmm.
She was actually a professional Broadway performer.
Hmm.
She came to me not because she was in any agony, but she
Hmm.
came to me out of sheer embarrassment.
Hmm.
Embarrassment for her because she said she would walk with her friends down the middle of Manhattan, and then they would just turn over to look behind themselves and see her sprayed on the floor simply
Hmm.
because she lost her balance.
Oh,
And so
wow.
she wanted to get to the bottom of it. And so I obviously did an exam. I saw that she was had a lot of laxity meaning she was incredibly flexible, and as you
Hmm.
should be if you're a Broadway performer. But
Hmm.
I ordered an MRI just to see what was going on because it was just too lax or too flexible. And lo and
Hmm.
behold, I discovered that she actually, over the years, had destroyed a lot of ligaments and even tendons. And
Wow.
so this is a procedure that's routinely done by me. In fact, I do this multiple times a week for nearly 20 plus years. But
Hmm.
with this particular individual, it was so badly damaged that it required further further material or further um, hardware that got her to the place that she needed to be. So just to cut a long story short, after multiple visits post-operatively, she did present to my exam room probably about 4 to 5 months after surgery, and performed for me. And if you're asking what she did exactly, she did a combination of belly dancing and not to
Oh,
mention
wow.
tap dancing.
Oh, nice. Awesome. That's great. So basically the recovery was 5 to 6 months and it was successful story for you.
Oh, yeah, absolutely. And this is, like I said, this is unfortunately or fortunately, it's a very common procedure
Hmm.
for my practice. Ankle
Great.
sprains are very, very common.
Great. So, I mean, that's great that, people can feel rest assured that, they will be taken care of about this particular problem if they come to you. Okay, so the last question we have is, how important is a strong online presence for today's patients, in your opinion?
Well, it's 2026 now. It's vital, in fact. Um,
Hmm.
Obviously, being a very good practitioner provider is obviously fundamental. That's your foundation. That's very, very important. But how do
Hmm.
you get that message out there? And the way that happens is through obviously good, appropriate marketing.
Hmm. Yeah, that's true. And I mean, in this day and age, if people cannot see you who you are, through social media, then it's very difficult for them to make a decision.
Yeah, of
Sometimes it's
course.
just it's just a matter of going on Googling you and other doctor and looking at your profiles, which by the way we manage your profiles on different platforms as well, so that people can go and they can check you on WebMD and other web profiles as well. So that's definitely important.
You know, like
Uh,
and pa patient retention, not to mention obtaining new
yeah.
patients, has definitely increased. Obviously, with marketing, and definitely happening with my collaboration with your outfit, ZoomMD.
Great, great, awesome, awesome. Thank you. So I think this was a good session, and we look forward to do another one next month with new questions and new insight into what Dr. Afan has to offer. Thank you.